Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain Free with Dr. Marc Darrow from the Darrow Stem Cell Institute in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified in physical medicine and rehabilitation. He teaches about the use of prolotherapy, PRP, and stem cells. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Nita Valens.
Hi there, Dr. Darrow.
Hello, Nita. Are you living it up like I'm living it up?
Absolutely.
I love it.
Every day, we're living it up.
You have to.
I agree. However, the reason we're here is probably we have listeners that are in chronic pain enough to not be living it up. So we want to help out with that.
Absolutely. We're going to get into all sorts of syndromes that hopefully our callers will let us know about, people that are having pain in the orthopedic realm of their joints, arthritis, tendons, ligaments, rotator cuff tears, hip labral tears, meniscal tears, plantar fasciitis, gamer's thumb. There's all these, there's a gazillion different types of orthopedic syndromes that we run across. And I treat, I think, all of them using regenerative medicine, which is a very conservative form of medicine where we just do injections using your platelets and stem cells to help rejuvenate, heal, and grow back the tissue that's been injured instead of cutting it out. I had a lot of training during medical school and my internship and residency in orthopedic surgery, and I loved it, but I think this is a better way when you can get away with it. Surgery is definitely needed many times. I'm not poo-pooing surgery, but I don't think it's appropriate for most of the surgeries that are done today in the orthopedic realm. So that makes me the devil with orthopedic surgeons, I'm sorry to say, and we should be working together. But the problem is that the surgeons don't believe in what I do. And I believe in what I do because I've been doing it 25 years with amazing success. If anybody wants to look at reviews of my work, they can go to yelp.com, YELP.com, and type in Marc, M-A-R-C, Darrow, D-A-R-R-O-W, MD, Los Angeles. And there's hundreds of reviews there. Some are nasty. And the problem with Yelp is that doctors are not able to respond to what patients write down or people write down because of the HIPAA law, which is a privacy law. I can't even say if someone bashes me what really happened. I'm not allowed to say that that person's even a patient. Can you believe that?
Well, that's the communications, as you say, the HIPAA law.
Yeah, Yelp is making millions because people love reading bad news.
Well, and people like to whine and complain, especially recently. There's maybe more to whine and complain about due to the pandemic. But when you say surgeons don't believe in this, that's like me saying, well, I don't believe in this microphone, but I'm talking to you on it. I am talking to you on this microphone.
I've had so many cases where patients have gone to a surgeon first, because that's our culture, go to the surgeon when you have an orthopedic issue. And the surgeon says you need surgery. And then the person doesn't want surgery. They come to me and they get healed. And then they go back to the surgeon for a follow-up and say I was healed. And the surgeon goes, well, it couldn't have been from what that guy did because you can't grow tissue. But they're not reading their own scientific journals, which shows that we actually do grow tissue using regenerative medicine, using stem cells and PRP, platelets. That's been around forever. And back in the day, as you know, Nita, we used what was called prolotherapy, just a simple thing of concentrated sugar water, dextrose. And that would cause an inflammatory response. And from that, fibroblast would come to the area of injury where the needle was poked. And my microphone out of my earbud just fell out. I'm reaching for it behind my back. This is so fun.
That's hilarious.
So I can't
but
hear
that
you
was
yet, but
that
I will
was
in
the
1 second. Here we go.
Okay.
So medicine is a mess, just like everything on this planet can be, if all you're thinking about is the money involved. And surgeries do create lots of money for people in hospitals, and I don't think that the surgeons are bad guys. I love the surgeons, but the culture is to operate when it's not needed for most of these things. And actually, I just read recently that the Veterans Administration, which is this giant administration, governmental institution, is backing off from doing surgeries on the knees because we know from studies that people do just as well without a knee surgery for things like meniscal tears as if they get the surgery. And why do a surgery where you can get infected and cut tissue out and destabilize the joint when just doing things like physical therapy can help? And we get, on this show, we've been doing the show, 20 years or more. We get people call in almost every single show who say, yeah, I was told I needed a surgery, I didn't get it, and I'm better without anything. And I always tell people with, my patients when they come in, tongue in cheek, I say, the safest thing for you to do is just stay away from all doctors. It's true.
Yeah, it
the
is.
number 3 cause of death, what is it?
Iatrogenic.
Iatrogenic. So we have heart disease, we have cancer, 1 and 2, and then we have iatrogenic, which means you can die. This is the causes of death. You can die from going to a doctor. Right. What happens? You get infected from surgeries. You can go to a hospital and pick up a bacteria you can't get rid of. Hospitals are bad places to go to. And I think I've told this story before. I had a pheochromocytoma. How do you spell that, Nita? You'll never get it.
I'll never get it.
And I checked with every known doctor around the planet who did these, and people who had done studies so I could find them. And I went to National Institute of Health, and I spent like a month there with them doing every frickin' test in the world to see what this thing was, and they used me as a guinea pig. I finally ended up with Quan Du, who was a surgeon at San Francisco General Hospital. I actually flew up from Los Angeles to have my surgery up there because this guy had done the most of anybody. He had done at the time, this is years ago, something like 300 or 350 of these. And the guys in LA that had done them that I found, the top guys had done like 1 or 2.
Oh, no.
So I knew good. I had, no, not good. And that's something I always tell patients. Go to the doctor who does the most.
Was that little tumor on your adrenals? Is that what you're talking about?
Yeah, it was 4 centimeters. That's like 2 inches. And supposedly it was supposed to kill me because it released adrenaline. And I was going to heal it naturally, and I played with it for 4 years, wasn't able to heal it, and I finally had it dissected out and cut out. And so that thing's gone. Hopefully it doesn't come back. It's like a cancer. They don't call it cancer because it doesn't eat up the body. It just produces release of adrenaline, which can stroke you or just kill you with a heart attack or something like that. Anyway, that's gone. But my whole point here is when I went in to get the surgery, Dr. Du said, after the surgery, he came in and says, you have to leave the hospital right now. And I go, I can't move. I'm in so much pain. It was, abdominal surgery. He goes, I don't care how much pain you have. You're out. And they pulled all the plugs in me and got me out. He called a cab and sent me back to my hotel, where I recuperated under the covers for 4 days before I went back to see him. And he said, I've never had an infection because I kicked people out of the hospital. And that taught me a lesson. Don't go to hospitals if you can help it. And then if you have to, get out as quick as you can. Sometimes you can't, but sometimes you can. And I'm glad they're using surgery centers a lot instead of hospitals for surgeries now, because you just go in and you go out and go home. It's a better way to do this. So I'm going to give out the phone number now. So get your pen and pencil. If you have eidetic imagery in your mind, that means a photographic memory. You won't need it, but not too many people do. Nita, you ready? It's 866.
Yes.
870-5752. I'm going to repeat it because I want you to call me now live, and you can talk to me about anything in orthopedic medicine, whatever your pain is. It can be about your relatives. It can be about your friends. You can use a fake name. We're going to love you if you call in, though, because we love our callers.
Well, we didn't even say the best part. They get your latest book for free.
That's right. Stem cell and platelet therapy, regenerate, don't operate. It's let me see how many pages I'm holding. It's about 200 pages.
But it has 264 scientific studies.
That's right. This is not stuff that I'm making up. This is stuff that's been studied and is in journals that have been reviewed. And it took me 5 years to put this together. It was not an easy project. But I did it because the orthopedic surgeons kept saying there's no research on it. And I looked all this stuff up. They did the research. I don't get it. Anyway, the phone number, give me a call right now, 866-870-5752. If this show is played at some odd time, because sometimes they take it and do recorded sessions of it, I'm going to give up my number to my office so you can catch me there and get more information. The phone number to my office is 800-300-9300, 800-300-9300 to the office, and the website where you can watch me doing videos of this stuff. You see how easy it is. You walk in, you get injected, and you walk out. It's www.lastemcells.com, www.lastemcells.com. And once more, we're getting a bunch of callers coming in. I want to pump this up, get more of you guys. 866-870-5752. Nita and I want to hear from you and see what your musculoskeletal complaints, your orthopedic complaints are about, so we can help educate everybody else. By you calling in, you're going to help thousands of people learn how they don't need to have surgery in most of these cases. There are cases where I have sent people to orthopedic surgeons or neurosurgeons for surgery, but it's really rare, and I can't think of the last time I did it. And I'm going to go to Mike. You have a chiropractor, and somebody has an L5 issue. Tell me about it, Mike. What's up?
This patient has an L4, L5 spondylolisthesis.
Okay.
So, probably had it for 10 or 11 years from a fall.
Yes.
I just saw her a few times, wasn't making, very little progress. I saw her MRIs, X-rays from, 10 years ago and recently. And so I said, hey, you should go see Dr. Darrow, who I've listened to on this radio station. And
wow, thank you, Mike. By the way, Mike.
Have you ever treated spondylus?
Oh, yeah, all the time.
Significant spondylus.
All the time. First of all, Mike, why don't you give your last name and your phone number so people know who you are and then come see you?
Okay, well, my name is Dr. Mike Spearman. I'm a chiropractor in Hollywood, Los Feliz area.
Yep.
My phone number is 323
Yep.
384
Yep.
2133.
Okay, good.
And
See, I love chiropractors. I want everybody to know I love chiropractors. I love surgeons. I love all
healers. Like you is in our philosophy.
Yeah, I love all healers. And everybody heals in a different way. There's thousands of ways to heal the body. And if any one of them works one time, I'm happy that happened. So I don't have my nose up in the air about I'm better than other people or other people are better than me or any of that stuff. I'm sure, Mike, that you heal tons of people. So let me just give you a couple ideas. Number one, spondylolisthesis. Listhesis means slipping. It means one of the vertebrae, and that's L4 on 5 in this case that you're mentioning, has moved away from anatomical position. If the person does not have any problems in their legs with some type of a neuropathy, that listhesis doesn't mean anything. Most people with spondylolisthesis don't even know they have it. It's very prevalent in Eskimos, where the pars interarticularis is fractured and those vertebrae can move backwards. When you said you thought it's been there for 10 years secondary to a fall, the truth is that person may have been born like that, and they may have died like that unless you got an X-ray. No one would have ever known about it. And that's the problem with diagnoses and using modern, quote, modern medicine, which is not modern at all. It's a travesty as far as I'm concerned, because too many doctors treat based on images, and the images don't tell us where pain is coming from. Only our examination and the history can tell us what's really going on. You and me, Mike, have to find the pain generator and then work on healing that. And that's not the way medicine is done today. It's the way my grandfather, who was born in the 1800s, did medicine. But today, everything is high-tech. Let's get the image right away and find out where to operate on. That's nonsense. I have new patients come in every single day telling me they need to have a surgery and they don't want to do it. And they show me their MRI and they say, the surgeon said, look at that MRI, that's terrible. I say, did the surgeon examine you? They go, no. They look at the MRI. That's a terrible way for me to think about trying to fix somebody, trying to heal somebody. So yes, you and I are on the same boat. And does this patient of yours have back pain, low back pain?
So yeah, she's low back pain. She's quite obese. She's probably in her mid 60s. She has Medicare, and I mean, I'm familiar with most of the stuff you said.
All right. So here's what I do, Mike. When someone walks in the door, let's say with low back pain, the first thing I'm going to do is have them lay face down and push in certain spots where the enthesis is. That's where the ligaments, tendons, or muscle attached to bone. Those are really easy to fix. And that's about 99% of the back pain that comes to my office. All right? Some people come in, that 1%, where they go, I've got spondylolisthesis, or I've got stenosis, or something like that, or herniated disc, and I have no back pain. I just have a numb leg or a dead leg. Those are the cases I'm going to send to a surgeon, because that probably is something to do with the nerve that's impinged. But at the same time, that being said, there are people that if we inject the areas in the low back that can refer down the leg, we can sometimes heal what we think are radiculopathies, and they're not. They are not nerve impingements. They're referral patterns from the low back. Same thing with the neck down the arms. So we have to be very careful not to get a surgery when it wouldn't help anything. And I have had endless patients over the last 25 years who have had neck or back surgeries that failed because it wasn't done for the right reason. We even had a guy on the, remember Kathleen, Nita, who called in, whose husband had a neck surgery?
Yes,
and he died,
that was
and
tragic.
He died from it, yeah. He woke up with a trach, and not a trach, he woke up with, breathing machine, And,
he was on a respirator, she said.
He was on a ventilator, yeah. So
I'm definitely. I told her to watch your show, but I'm going to now tell her that I talked to you, and I'm definitely going to get her to give you a ring.
Yeah, and Mike, I'm going to give you a call later today so we can touch base and refer to each other, because you're the kind of guy that I think is amazing for people to go see. Again, this guy's name is Mike Spearman. He's a chiropractor, and his phone number is 323-384-2133. So I love chiropractors. I go to them whenever I have issues that I can't fix by injecting myself, and I do inject myself frequently whenever I have an injury. I get a lot of sports injuries. I'm a hardcore athlete at the age of 74. It doesn't stop me.
Yay.
And I have to say this, and this is no BS. I've been injecting myself for 25 years for sports injuries, and it never once has failed me. Every single time that I've worked on myself, and I self-inject. I can't inject my neck or back. I've had other people do that when I've injured myself. But anything on the front or side of my body, I've done both my shoulders, my knees, what else? Shoulders, knees, my elbows, both my elbows were locked up, my right wrist. And recently, I had a gout attack on both my knees, and I just want to say they are better also. I've been injecting. It took about 3 months on those because there's actual. I'm getting real feedback here. Alex, can you pick that up? Thanks. I have calcium deposits in the cartilage in my knees. I have meniscal tears in my knees, and I went running last night, and I had no pain at all. So this stuff works. It's not going to work on everybody. I'm not going to make this out like a panacea or miracle. It is not. It just makes sense. And I'm a simple guy. I was raised in Chicago, and we had a little shack in the summers in the Indiana sand dunes, no running water. We had to pump our water. We had an outhouse. We had no electricity. I'm a simple kind of person. And the way I describe this, and you might say, really, that's healing? Yeah, it's the way I describe healing. If you have a hole in the ground, sometimes it takes a lot of shovelfuls of dirt to fill it up. And that's how this stuff works. When you inject stem cells or platelets, it's not some miracle panacea where you just fly off to heaven after an injection. You have to do the work, and sometimes that's several injections. I've had parts of me I've injected that have healed overnight, literally overnight, and I had a surgery on my shoulder that really jacked me up for years until I learned about this. And I was experimenting, and I injected my shoulder, several pokes, woke up the next morning completely pain-free with full range of motion that I didn't have before. And that woke me up that this stuff is certainly better than surgery. It's simple, it's easy, there's minimal side effects to it. And I love it. I love every day when I go into the office and can help people. So I'm excited about it. You can tell my voice is moving quick. But again, it's not going to work for everybody because people quit too soon. They go, I tried it, it didn't work. And that's what happens with the orthopedic surgeons. They go, I tried it on somebody, it didn't work. Well, your surgeries didn't work either, because I get all those patients where it screwed them up bad. So, you got to pick the right people. They've got to follow your orders. Other people, it can fail if they're taking anti-inflammatory medicines like ibuprofen, because we're trying to get an inflammatory response. And then sometimes, most doctors don't know how to use an ultrasound to look inside the body. I have 3 of them in the office. We roll them around from room to room, and I look inside, and that is how I guide the needle. I can put the needle exactly on the spot that needs it. And then another reason it fails for people is they get what I call a bad doc, someone who doesn't know what they're doing. If, for example, I've had a lot of people go to surgeons and they get 1 shot of stem cells or platelets and go, it didn't work. When I inject a shoulder, it's probably 30 injections. I'm going to hit every rotator cuff tendon. I'm going to hit the subdeltoid bursa. I'm going to hit the joint. And when I hit the joint, I know I'm hitting the joint because I'm looking inside with an ultrasound. If you don't use an ultrasound for the hips, for the knees, for the shoulders, if you have a doctor who's injecting you, there are studies that show that 1/3 of the time at least, they are missing their target, doing it blind. So you got to be careful to pick the right guy. Always go to any doctor, including regenerative medicine doctor with stem cells and PRP. Make sure they use an ultrasound and make sure they do tons of it all day long, every day of their life. Ask them. People are shy. I say, ask this guy how many times they've done this procedure today, yesterday, the day before, last week, last month, last year. How often do they do it? Go to the guy who does the most of anything. I don't care what it is. So I'm going to go to Mike. Thank you so much. I'm going to give you a buzz later. We're going to go to Laura in Encino. She's got a question about surgery. Laura, I'm going to give out my phone number one more time so more people can call in and talk to me live right now. So the phone number to the studio to talk to me and Nita is 866-870-5752. I'm going to repeat it once more, 866-870-5752. You get a free copy of my book if you call in. Stem Cell and Platelet Therapy, Regenerate, Don't Operate. It's a big book. It's got like 260 studies on how this works. The foreword was written by Suzanne Summers, the famous actress who I have worked on. I've worked on her son Bruce and her grandkids, and I've been working on them for about 25 years. They keep coming back for some reason. Maybe it's working. Poor Bruce is a biker. He rides bicycles. And boy, he was my next door neighbor. He would come in after he was bashed up from falling, and I'd inject him laying on a table in my living room or on the floor.
That's hilarious.
So Laura, tell us what happened. What's your question about surgery? I want to know. Everybody else does too.
Hi, Laura. Are you there? Laura?
Laura!
No, I guess not. Okay, Laura, call us back.
Well, Laura, I hope you call us back at 866-870-5752. And go to my website, www.lastemcells.com, to watch these procedures. And call at the office, 800-390-300, if you want more information.
And you're listening to Living Pain-Free with Dr. Marc Darrow. I'm your host, Nita Valens, and we'll be right back after these messages.
You're listening to Living Pain-Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.